For more on school reopenings, we're joined by Dr. Kate Tulenko. She's founder and CEO of Corvus Health, a global health firm. Welcome back, Kate. Good to see you.
Thank you.
So, Chicago students are finally going back to school after months of tense negotiations that nearly saw a strike. Is the rest of the country ready?
I think we'll slowly see the schools reopen, and the CDC coming out with this statement will help. And we have to keep in mind the fact that all other essential workers have returned to work without the vaccination. So, healthcare workers returned to work before they were vaccinated, transportation workers, childcare workers, grocery store workers. So the teachers are the last essential workers to return back to work. And the CDC based their guidelines both on evidence in the US and evidence in Europe, where their schools have been open longer. And the truth is, where schools have followed proper guidelines, there have not been significant transmission within those schools. And also, it's quite interesting, the New York Times interviewed 175 pediatric infectious disease specialists to see what they thought about reopening schools. And they all had different opinions, but the majority opinion was that schools were safe to reopen if they followed proper guidelines.
I'm glad you brought that up because there is that big argument that school closures really haven't even helped control the pandemic, and with that research you cited, schools perhaps aren't all that big a setting for transmissions. Is that what parents are all now pushing for?
Exactly. It's clear the major drivers of the epidemic are, people not wearing masks, people going to bars and restaurants, community gatherings where people don't wear masks, but that schools where people mask, have social distancing, have hand washing, they're safe.
And Kate, what about the effects of these new coronavirus variants? How's that driving the debate of when it's safe for kids to return?
Well, at least the good news is the way of protecting yourself against those variants is the same as how you protect yourself from the original variant. And, I think the CDC was quite clear in their guidelines, the 5 major interventions, masking, social distancing, hand hygiene, improved ventilation, improved cleaning, and then the contact tracing and isolation.
Now, the other thing is, a big portion of going to school is that social aspect, even lunch break, extracurricular activities. Now, when kids return, they're not getting that same experience. Do you foresee a long-term impact of this?
Well, I think that even the 2 days a week, which many schools are going to return to, will make a big difference socially. We know that in Las Vegas, one school system had 18 children commit suicide in the last year, and thousands of mental health alerts based on children's suicidal thoughts or other, major psychiatric symptoms. So even 2 days a week will be enough, and we know that they won't have free lunch, freely associated lunch. We know they won't be able to do the regular sports. But I think even just 2 days a week will make a huge difference to children.
Well, President Biden did say that he wanted all children from kindergarten through 8th grade to be back in school in his first 100 days in office. That's about mid-April. Do you actually see this happening?
I think the vast majority of schools will have some in-person teaching by then, absolutely. And I also think, with this rollout of the vaccine in the pharmacies, that, by then actually we'll see many more teachers vaccinated. I'm lucky enough to live in Virginia, where teachers are a priority for vaccination. And for my children, most of their teachers will be vaccinated before school restarts.